Hi, I'm Samantha Cash, and today I'm going to be talking to you about the importance it is to have the communication between a nurse and the patient. It's very important to have that relationship and that bond with your patient as a nurse, because if not, life is just going to be much more complicated than it needs to be. It's much easier if you and your patient get along and have a better understanding of one another. After listening to my informative speech today, I'm hoping that you will have a better understanding of how important it is to have that communication skill between the nurse and the patient. One of the main topics today that I will be talking about is how important it is to practice your communication skills. The more you practice anything, the better you're going to be at it. As we all know, practice makes perfect, and you should continue to practice your communication skills with your patient. Also, as a nurse, I feel like it is very important that you know a variety of languages and not just the one language that you are best known as, which most likely the number one language in America is English, and most nurses at the hospitals here in this area know how to speak English, but it's a very good idea that you know other languages, because if I was a patient coming into a hospital or a doctor's office and I can't communicate with the nurse or the doctor because they don't know how to speak my language, that's going to be very frustrating and no one's going to understand each other. So that is a very important point, to know how to communicate with your patient. If you don't understand their language, it's a very good idea that you try to learn that, because there can be some conflict there. Also, there are two types of communication skills. There's verbal communication skills, which is anything written or spoken verbally, which is the most common communication skill in the medical field. Then there's nonverbal communication, which is unintentionally or intentionally said, but it is also very misunderstanding. You can misunderstand someone very easily if they're using the nonverbal communication skill, which that would not be very good if your patient misunderstood something that you said or done to them. That could make them very unsatisfied. And the main purpose of being a nurse is to make sure that your patient is happy and satisfied as they come and go, because you want them to feel at home and feel welcome to come back to that hospital. Even to know them by their name will make them feel very, very welcome. That's also very important, that you share things with your patients. You share that communication skills between one another, get to know one another better, and not just go to work, go in there and not talk to them, not communicate, and leave. You're not going to get a very good review that way. I feel that it's very important to know the patient by their name and know things about them so that you can share that bond with one another. Also, after learning about the communication skills between the nurses and the patients, now I have a better understanding, and I plan on being a nurse very soon, someday, I am hoping. And after doing my research, now I know, and I am going to be able to communicate with my patients a lot better and to better understand them. So I am hoping that today I have helped you to know how important it is, because without communication, this world would be chaos, and everyone would just be insane, because there would be nobody would know anything and no one would be able to talk about anything, and we would all be misunderstood. So I am hoping that you have learned the importance it is and how important it is to be able to communicate and share a bond with your patient and to make them happy and satisfied. Thank you very much.